Interface Video, in cooperation with Fairfield Federal, presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fair Hope Hospice and Palliative Care, the Frankie Smith Funeral Home, Fairfield County Adam H., Dagger Law, and the Fairfield County Board of Developmental Disabilities.
Hello friends, and welcome to Fairfield Today. I'm Paul Jasson. Thank you for joining us. Pleasure to be with you as we broadcast and telecast from the lobby downtown. The beautiful lobby, reopened months ago now with Fairfield Federal here. Things are, I'd like to think they're getting back to normal. Each day you see more and more businesses opening up, more places having full capacity, restaurants, everything is coming on. And that's a subject we're going to talk. The second segment of today's show, we'll talk to the mayor a little bit about that, but more about economic development. There's a lot happening here in Lancaster right now, and things are really picking up. It's a good time for the economy here in the city. We'll talk to the mayor about that in the second segment. But our first segment, and we've talked about this before, I think in the since we've come back on the air, maybe 4 or 5 months, I doubt if there's been one single segment of the show that we haven't talked about COVID-19, the pandemic, how it's affected, because anybody we've had on has had an effect from that. So now we're going to talk to the guy that's got all the answers right now. That's a lot to put on you. Joe Ebel is the Fairfield County Health Commissioner. Joe, thank you for joining us, taking a few minutes. I'm sure your schedule is piled up. I mean, it's probably unbelievable the things you have to take on. If you looked at this job a year ago, while it was busy, it's probably nothing like it is now. You probably got a pretty fair schedule.
Yeah, a year ago it was mostly responding to the outbreak as it was developing, but we didn't have the tools as far as the vaccine to really be able to do anything and move towards recovery. So we're really kind of in that recovery phase now, where we're able to get people vaccinated. We've got better health care, know more about the virus, and kind of hopefully moving towards the end of this pandemic.
Is that what you feel? You feel like there's an end in sight?
Yeah, definitely. The number of cases are dropping. We haven't hit the vaccine targets that we really wanted. In Ohio, we're in the 40s as far as the number of people that...
Was it over 50%? Was that where you wanted, or even higher?
Ideally 70%.
Okay.
I think right now
you're way below.
Yeah, there's 12 states in the nation that have hit that 70% of people having at least one dose. And in Ohio, we're still under 50.
Well, the governor's given us a million reasons why we should sign up for this right now. And I think that's probably his little Vax-A-Million project. And you hear good and bad. I guess I think it's good, but do you think that's helped? I've heard that there was an increase.
Yeah, we've seen it here and in a lot of other counties that I've heard from. They've seen an uptake in the vaccinations.
Good.
And really, when you think about it, all the money that's spent on the TV ads promoting it, things like that, is just another promotion way to reach out to people.
And, for the longest time, the big deal was people were begging for the vaccines. They couldn't get them. There was never enough for any county, any drugstore, any doctor's office. You couldn't get them. And now it's completely flipped from that. I would assume more people or more places have vaccinations than now at this time people really want.
Yeah, the trick is making it as convenient as possible, because some people, if they happen to be at the store and it comes over the PA that you can get your vaccine while you're there, they might just decide on the spur of the moment to do it, but maybe wouldn't make a plan to get an appointment and things like that. And I think that part of the demand is we see the same thing in flu season. If the media comes out and says, there's going to be a shortage of flu vaccine this year, then people line up, like crazy trying to get it. But if there's plenty of flu vaccine, then people aren't as excited. So I think, right now there's plenty of supply, so there's less, urgency in the population.
Let's go back a little bit right here. Joe is a relatively new employee in Fairfield County, been on the job as Fairfield County Health Commissioner for maybe a month and a half now. You didn't come in right when the pandemic was strong. Your predecessor, Larry Hanna, had all those headaches, or at least most of them. So you come on now in 6 weeks, and what's been your take of the county and how everything has been handled?
Well, I think we were able to bring in additional resources, and with the funding that was available through the feds and through the state, And that really made a big difference in this county because our health department's not that large, and public health, statewide, nationally, has always
Sure.
been underfunded.
Yeah.
So when you do have to, respond to a pandemic or some other large type of public health emergency, it's hard to do
To
that.
ramp up quickly.
So we're able to do that with this short-term funding, and then really part of my job will be looking into the future. Once those grants are done, how can we really build that infrastructure, build that capability so that we're better able to respond to hopefully nothing quite this big, but when the next thing comes along.
And there's always the next big thing right around the corner. June 2nd, the governor said things opening back up. We're getting much closer to being back to normal. As of June 2nd, restaurants, are they allowed to open up full go, or what were they allowed to do?
Yeah, all those restrictions will be lifted other than in some healthcare settings, nursing
Sure.
homes, things like that.
And it seems to me that maybe, well, obviously the hospital, they're still requiring masks at this point. They still require a mask, and that's understandable. But it'll be up to each individual business. If I owned a restaurant, it'd be up to me if I want to say either you have to wear a mask, or I could say if you've been vaccinated, you don't have to wear a mask. That'd be up to each individual.
That's right. Yeah, it'll be up to that, that property owner, that business operator to make that decision.
Sure. And I want to talk a little bit about your vaccination, the way it was handled here in the county. I got mine through the VA, so mine was handled like that. But my wife got hers through Fairfield County, and I can't tell you how efficient I thought they were. She was in the upper bracket in terms of ages, so one of the first people to get called. And we got numerous calls about would she be ready? Is she wanting to get it now, scheduling her. They were very efficient about that. And so when the final call came to schedule her, the first time she was out at the fairgrounds, you had a drive-through set up in there, back in the building, back in the back. And then by the time, 6 weeks? I can't remember the time between shots.
It's usually 3 or 4.
Maybe it's 3 or 4 weeks. But when you got the second shot, your office had changed it and you were out in the mall now. But both were terribly efficient. You had a lot of volunteers working. Actually, I liked the one at the fairgrounds better. She didn't have to get out of the car, just sat in there, got a shot, waited in a line for 15 minutes, on our way. But I'd say your folks, with the people you brought on extra for this, just did a tremendous job.
Well, thank you.
Yeah, just... And so you're still at the mall now.
That's right. We're going to be at the mall through the end of June.
Okay.
And in July, our plan is to move the clinic back to the health department offices. And we're also doing smaller outreach kind of clinics. So, if there's churches or schools, places that, any events where there's a lot of members of the public there, if we can get out and, if we can hit 10 or 15 people, that's great.
And probably most people that would have no reason to know much about the health department. You do so much in the county that kind of goes under the radar. And I know you inspect all the restaurants, you check everything there. You just do all kind of sanitation things. Has any of that taken a back burner, had to suffer a little bit because of this? Have you had to pull all your resources at one time into the pandemic?
I think initially the environmental health, the inspection piece suffered some, especially with restaurants. We didn't want to send staff in when they weren't
Sure.
even, having
Sure.
customers in. And so we've been trying to catch up on all of that work. With the housing boom related to, the housing market right now, there's a lot of work with sewage and wells, new construction, plumbing.
And that all falls under your bailiwick.
That falls into the health department. So, we've been real busy there. The biggest impact has been to our public health nurses because they've pretty much just been nothing but COVID. So childhood immunizations have fallen behind. So we're planning in July to start back up that back to school vaccine program that we normally would have, which is always a busy time of year. But with a lot of kids that maybe didn't start school last year or didn't get their vaccines updated, we expect to see a lot more kids that need to get those vaccines taken care of before they go to school.
Talking with Joe Ebel. Joe is the Fairfield County Health Commissioner, new on board about 6 weeks, month and a half here. Something we haven't heard much about is the flu vaccine. Has that been given as much as it always was given? Has there been many flu cases? What's the kind of the update on just the regular flu that we would, had we not had the pandemic, we would have had this flu shot by now?
Well, that's probably one of the most interesting stats that we've seen come out of this is that, the flu's still here. It's, people got vaccinated. I got my vaccine last
Sure.
fall like I normally would.
Sure.
But the number of flu cases has been at a historic low.
Really?
And, that really just goes to show that those, things that we put into place to prevent one
distancing,
airborne vaccine that's spread person to person, really worked in controlling the flu. So social distancing, staying home, wearing a mask, all those things knocked the numbers down to where, we really saw almost no flu cases this year. So it was interesting just to see, when you put that into practice, there's a real clear indicator where we would have normally had a lot of cases and they just didn't show up this year.
That's interesting. Sometimes you learn something else by digging into something else. All of a sudden this has come out, and maybe you folks knew that all the time. If people washed their hands more, if they didn't have as much contact, if they stayed away from more people, obviously the incidences of flu would be down. And so that's kind of what you actually saw come into practice.
Right, and I think it also is an indicator to, since we put those things in place, and the COVID numbers were what they were, we really didn't know, well, what would it have been if we hadn't done anything?
Yeah.
And
What's your projection on that?
I think that, based on those kind of flu numbers, it tells us that it would have been a much higher COVID rate this past winter than what we had if we hadn't put those things into place.
So obviously those were great procedures, and you just wonder now, as we move into this time frame where masks are off almost anywhere, people are back to being as normal as they could be. You just wonder if everybody always carry a mask in their car. Will there always be someplace out there that'll have to have a mask? Will we respect that 6 foot distance thing? I mean, you just wonder where we'll be headed in, let's say, 6 months from now.
Right. Yeah, I think people will get back to normal.
Yeah.
And the hope is that when fall comes around, we don't see another wave of cases. And I think that's really where, even though the number of new cases is down quite a bit right now, if you haven't been vaccinated, you need to do that and get that protection, because as everybody moves back in and schools start back in-person classes, we don't want to see a surge show up in September, October.
We've got less than a minute here. Quick question. I wanted to ask this earlier and I didn't. Are we going to have a booster shot?
I think that eventually we will. Just like H1N1 that we had a few years ago, it's still the predominant flu strain most years. It hasn't gone away. So I think, whether that's at 1 year or when that is going to be, it'll be, this virus isn't going away, so we'll have to get some kind of a booster.
Well, Joe Ebel has been with us. Joe is the Fairfield County Health Commissioner. Again, your office has done a tremendous job in the county. Thanks for all the work you put in. You guys were frontline people, and I think you just handled this thing wonderfully. Thanks for everything you and your staff did down there. You do great work.
Thank you.
Sure. Joe Ebel, Fairfield County Health Commissioner. We'll be back to talk about a little bit about the flu, but other things with the mayor in just a moment.
The Frankie Smith Funeral Home and Crematory in Lancaster and the Johnson Smith Funeral Home in Baltimore have a long and wonderful history of serving our community. Feel free to give us a call at 740-653-0652. Stop in and see us at either of our 2 locations, 405 North Columbus Street in Lancaster and 207 South Main Street in Baltimore. Respect for tradition, regard for change.
Fairfield Federal. When it comes to our customers and our community, we go above and beyond to help. Our people make the difference.
We were retiring from Tucson, Arizona, and we made a retirement trip out around Ohio, having decided that's where we wanted to be. And we came across this town called Lancaster, and we fell in love with the downtown area, where the fountain is, and the memorials, and the flags, and all this stuff. And I looked around and I said, there's our bank right there.
There's something to be said about a community bank in your hometown.
Right. If you live in the community, you should do business in the community as much as possible. So it makes sense to bank with the community bank where you live.
Fairfield Federal is the bank to be at. If you live in this town, or any town actually, you want to bank at a local home bank. And the employees are happy here, they're conversant, customer service is through the roof. There's nothing more you could ask for.
Personal or business banking, whatever you need, we take it seriously because we know you do. Stop by today at any of our 3 locations and see why the difference is clear. Fairfield Federal Savings and Loan specializes in banking that revolves around you.
Member FDIC, Equal Housing Lender.
Welcome back to Fairfield Today. I want to thank Joe Ebel. Pleasure to have the Fairfield County Commissioner on. We used to have his predecessor, Larry Hanna, on, who was great with us, was able to come on. Joe is, I called him and he said right away, yep, I'd be glad to come on. So we appreciate all the help there. They've done a great job at the Fairfield County Health Department here. And our next guest, I think, has probably had more contact in the last year with the health department than maybe in all the years prior to that. Easily, I would say.
Yes.
Mayor Dave Scheffler is with us, and when I talk about you, or I talk to Steve Davis with the county commissioners and almost anybody in official capacity, I mean, he has a lot of power this past year. What he said kind of went.
Yeah, you get all these comments and suggestions that the mayor ought to do this and the mayor ought to do that, but the mayor really has no authority to do any of that, and neither does the governor. It's all those orders out of
88
Columbus
different people
came from the health department. The governor may have announced them, but the orders actually were by the health department because the governor doesn't have that authority, and neither does the mayor.
So a couple of weeks ago, June 2nd, the governor said, we're back, pretty much full go. Not be a long time before we're 100%, but pretty much full go. You think that was the right call? Too slow, too late? What would your humble opinion be?
I think it might have been okay a little earlier,
yes.
But June 2nd was good timing. And when the CDC came out, I think like the next day and said, okay, you can have at it now. It's kind of no mask required, outside, no social distancing necessarily. But if you've been fully vaccinated, you can have gatherings and meetings, etc. And that started immediately. That very night I went to a meeting and went in and there wasn't a mask in sight.
People were ready.
Yes,
they were ready.
It were men my age and a lot of public officials, physicians, attorneys, and I can say probably 99% of them had been vaccinated, so they didn't have any issue anyway. So.
Well, we're going to put that COVID talk on the back burner for a while, hopefully for a long while. But so we want to talk about economic development, and I've just been watching and hearing and reading in the paper. Lancaster is kind of on the move right now.
Lancaster is on the move, and one of the things that you read or hear about a lot, especially on social media posts, is, well, the city needs to go out and bring some jobs in here. They need to go out and bring in some plants, and what the public doesn't realize that is an ongoing function and mission.
It's like you ever stop doing that.
And you never stop doing it. It's all done extremely confidentially. Any company that thinks about coming here, we have to sign very strict non-disclosure agreements. We can't talk about it. And then, if we do get on somebody's radar, then they're looking at us and a dozen other cities around, and so who can check the most boxes on their criteria.
And I bet there are a lot of boxes.
There are a lot of boxes, pages and pages. But the way the system works nowadays is that almost all leads come from Jobs Ohio, because every state has an economic development function or department that gets all these requests, and a prospect will come with certain criteria for proximity to their suppliers and customers, for transportation, for water, for power, for a building or for land, for a workforce, etc. And then the state looks at what resources are around the state and then connects that prospect with us. And Mike Pettit is our Economic Development Director and also Executive Director of the Port Authority, and he does an outstanding job.
Sure.
No question, and it is a full-time, 7-day-a-week job. We just announced last week the Japanese company that is locating here. They will take over The building that the Port Authority built several years ago, and we commonly refer to
spec
it as
building.
a spec building.
Yes.
They take it over July 1st, and incidentally, that was probably the one key that helped us land the Magna plant, because we had that building available that they were able to move equipment and people into while their plant was built. And they used it for over a year, moved out, and then this Japanese prospect came up, and we had the resources, we had the building, we were all ready, and it came down. The last two were Lancaster and a city in Indiana, and of course they had lots of criteria, and this is their first U.S. manufacturing plant.
Nice.
So the due diligence that they performed was even more, I guess, widespread and detailed than what a plant might typically do. And I know Mike literally got calls in the evening on Sunday afternoons, and they had 10,000 questions and then 10,000 follow-up questions, and even down to last week, there's still just so many things
Sure.
that they wanted to make sure that everything was just right.
Is there any talk about building another building like that?
Oh yes, it's quite possible that we will build.
Because that's a
another
key
building.
point, as you indicated, a key component in why this happened.
That is a key component, and I know. I think over the years, the city was in for some criticism.
I can
because
remember
the building sat there empty.
Why would you do that?
But it brought a lot of people, a lot of prospects to town to look at it that wouldn't have come otherwise, because we had the building.
You won't get that criticism this time.
Okay, it's 50,000 square feet, and some people want 75,000 square feet or 125,000 square feet, and so it's literally checking the boxes, and the whole thing starts as a big funnel, and a dozen cities come in the top and one pops out the bottom, and gradually they get eliminated in the process. But it's not only industrial and jobs that are part of economic development, but places for our workforce to live. And here recently we've had two new developments open. East Point on between Wheeling and Mulberry Streets.
That would be the old East School.
The old East School with 64 units. And the last time I talked to Fairfield Homes, the school building, there's 28 apartments in the school building. It was 27 of them had been rented, only the very largest one, and there was one very large apartment had not been rented. And the townhomes, while they were not complete, they had pre-rented a number of them. The flats on Memorial Drive, kind of behind Ohio Health or KFC, had their ribbon cutting last week, and at the time of the ribbon cutting, they had 16 apartments finished and 15 of them were rented.
How many total back in
there? Ultimately, there will be 222 because of the cost of materials going up 200%, 300%.
Heard awesome numbers on that.
It will take probably a little longer to finish than they had originally planned, but they're renting them as fast as they get them completed. We have another residential development coming in at Timbertop. It's the Vision Company.
Boy,
and
that's phenomenal. You drive by that out there. It's unbelievable, because most people just remember one house that sat in the back, and then they had a stable there and something, but all woods.
Yeah.
And now you look at it now.
Right. So there are two things will be coming there: an assisted living facility and related patio homes that senior citizens can move into, and then as they become unable to live on their own, they can move into the assisted living. Yeah. That and Vision Development is going to be do a 205 unit apartments, and their developments are very nice with lots of amenities. I actually, one of the city council members and I did a secret shopper visit to one of their facilities in Columbus when they first talked about coming to town, and we were very impressed.
Really?
With what they do. So, and then there's room for a single family in the back. We have had a shortage of residential for a long time, and especially for low and affordable housing, the waiting lists are 50 or 60 families long, and even the market rate developments have waiting lists, or the occupancy is 98%, which is unheard of. And so East Point and the Flats are market rate and a little more upscale, and hopefully that will give the families in lower income housing a place to move up to as they, get jobs, get promoted, et cetera, and they'll move up into those newer and more upscale facilities. We still need affordable housing, and we work every week in trying to attract a developer to come to Lancaster to do affordable housing. For entry-level workforce, and maybe workforce housing is a better way to say that, but we continue to work on that, and hopefully we'll have some announcement here at some time, maybe this year.
Well, in the way you kind of talked about the rock mill with that plant out there, that you built that building, and then people eventually come to you and indicate they have an interest. For something like Timber Top out there, the genesis of that, did they come to the city and say, we're interested in this kind of area, or is that something that the city worked on and just looked?
We were approached by a developer, Lemon Development, looking for a place to build this assisted living building, and we showed them a number of properties, and when they saw Timber Top, they said, this is it, this is the one we want.
That was their vision. They saw that.
That was their vision.
How many acres is that?
It's 70 acres.
Wow.
The original mansion is still there. Lemon is still trying to decide what to do with it. Likely it will be for sale at some time. It would be an ideal Airbnb or bed and breakfast.
Phenomenal home.
The facility is just set up with bedrooms and private bathrooms for an Airbnb or a bed and breakfast place. Probably more bed and breakfast than Airbnb. It's too big for just unless you had,
So the stable and everything else, the other buildings, they're gone. Just
they are gone,
of the original,
or will be gone.
The Muse and
Right.
Cy Fulton's place. That the home is still there.
It's the manor house and the garages that go right in that.
It'd be nice if they could keep that, because I think out there on West Fair Avenue, I can't think what the condos are called out there on West Fair on the left as you're going out town.
Roxton Ravine, but they kept the original Kane home out there, which was part of my wife's family. They kept that, and it's a clubhouse. It's owned and it's used there, but it's right
nice.
In that development.
It's perfect, and
Well,
so it'd be nice if they could do that. So it sounds like Mike doesn't get paid enough for what he does. I mean, 7 days a week, calls day and night, hundreds of questions. He'll tell you that.
He just took a little retreat last weekend to get away and turn off the phone, and it's much deserved and earned. I tell you, he works hard, and the general public don't know and can't appreciate how involved that job is.
Dave Scheffler is our guest today. It's nice to talk about something beside the virus. We enjoy talking
positive.
about, and this has been real positive about East Point, Rock Mill, Timber Top, the Flats on 33 over here.
Big Lots is coming into the old Big Bear store on East Main Street.
Another nice addition.
Kokonis Furniture is talking about building a store on North Memorial Drive, a bigger place. I mean, there's lots of things going on.
That's great.
The Taylor property, where the old
Highway Patrol
is in process of being developed.
Nice.
So there's many things.
So as we talk about each time we have you on, there'll be many more economic things.
We hope so.
It's just a matter of, thanks for all the work the city does. Again, it's all behind the scenes, so much of it, and you don't hear about it until it happens, and all of a sudden look at that, overnight. I've got a factory
just like
here.
magic. It sprouted like a mushroom out there.
Dave Scheffler has been with us. Always fun to have the mayor on, talk about Lancaster and things going on. Again, a lot of fun to talk about some positive things for a change. Dave, thanks for being with us. Thank you.
My pleasure.
Thank you for joining us on Fairfield Today.
Interface Video, in cooperation with Fairfield Federal, presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fair Hope Hospice and Palliative Care, the Frankie Smith Funeral Home, Fairfield County Adam H., Dagger Law, and the Fairfield County Board of Developmental Disabilities.